Functional medicine is the future of healthcare. What is functional medicine? What are the benefits? And how is it different from mainstream medicine? Those are all great questions. I'm going to answer those today by both directly and by giving you an example of a patient. Functional medicine honors the patient as a unique individual with a specific, unique cause to their health challenge or health challenges. Whereas mainstream medicine looks at a patient as a list of symptoms and treats the symptoms, or looks at a patient as a diagnosis, assumes that diagnosis is correct, and then treats the diagnosis. Functional medicine looks at the patient as a person and honors the fact that that person is a system of interconnectedness. It's a system of systems that are all interconnected. It's a holistic individual. And functional medicine honors the fact that you can't change one thing in a person without changing the entire system. So if you come with a certain diagnosis or list of symptoms, first of all, we want to confirm if that diagnosis is true or not, but we also want to evaluate the body, the entire body, and all the systems to see, are there hidden causes to what is manifesting as symptoms in the patient. So we don't just assume that because it looks like a duck, sounds like a duck, that it is a duck. There may be something behind that duck that's causing the issue, if you get my drift. So with the patient I'm about to show you, this patient went to a medical doctor and she complained of hot flashes, moodiness, and heavy cycles. So this is not an uncommon ambulatory care walk-in patient. Many medical doctors, many chiropractors, many health practitioners, period, have patients walking in every day for whatever that doctor is offering, but also complaining of these kinds of symptoms. So my patient went to her medical doctor, complained of these symptoms, and the doctor, without doing blood work, said, well, it sounds like you have estrogen dominance, so I'm going to put you on progesterone. So from symptoms and chief complaint directly to hormone replacement therapy. Now, that's not good medicine, that's not a good standard of care, and there's so many things that could drive these hormonal symptoms that aren't even necessarily hormonally related, that more looking into this case needs to happen. And that's what functional medicine does. We don't make assumptions. We use objective data and testing to look under the hood and see what is in fact there, how is it all related, and then let's create a hierarchy of priorities to treat off of. So this patient has been using testosterone not testosterone, but progesterone for years, and the symptoms of the hot flashes and things have lessened, but the rest of her picture hasn't improved. And what I haven't told you yet is the rest of her picture. But this patient is a type 2 diabetic with uncontrolled blood sugar levels. Her fasting blood sugar is 312, her A1C is 9.6, and she's on Invokana and metformin already. So that's being on 2 diabetic medications that basically aren't doing anything for her. She also has hypothyroidism and multiple other comorbidities, including iron insufficiency. So if we took this patient and just threw her on progesterone and her symptoms went away, in the mainstream medical model, that's a win, because that model is focused on symptom suppression. It's not focused on getting to the cause. It's not even focused on health. It's focused on symptom suppression. Well, medications buy you time, but they don't produce health. Okay? What we want to produce is health, and what America needs is the production of health if we're going to survive as a country, because the current mainstream medical model and just the finances involved with that is failing the country. So, as I said at the beginning, functional medicine is the future of healthcare, and I'm about to show you how. Now, if we take this patient's case and we think about hierarchies and her metabolic derangement, we can, as a functional medicine practitioner, I'm looking at her holistically, and I can think to myself, well, first and foremost, this patient is a type 2 diabetic. So how does that play into the hormone picture, and what are the effects downstream of that? Okay? So we know that a patient with insulin resistance, and diabetes is just massive insulin resistance, we know that insulin resistance and insulin surges drive testosterone up. Well, if a patient has insulin resistance, she's going to have elevated testosterone. Elevated testosterone, it can do any number of things. In a female, elevated testosterone, if left there, is going to drive androgen dominance and drive androgenic symptoms. So she may get aggressive, she may grow facial hair, she may develop more acne, she may develop male pattern baldness. These are all things that, you know, women aren't looking for. Okay, so that female's body is going to want to adapt to that higher testosterone level due to the insulin resistance and inflammation that comes with it by potentially upregulating aromatase. The aromatase enzyme is going to convert that testosterone to estrogen. So if we have elevated testosterone and now the body's trying to protect us by converting that testosterone to estrogen, what do you think is going to happen? Estrogen levels are going to increase. Correct, those of you out there who said that. Well, when we look at estrogen and progesterone, there should be a certain ratio of progesterone to estrogen, and when you boil it down, it should be about 5-to-1 progesterone to estrogen. So this patient who goes and complains of estrogen dominant symptoms, what sound like estrogen dominant symptoms to the medical doctor, and is put on progesterone, really, she has a relative estrogen dominance, but a lack of progesterone is not the issue. Okay? So when we look at an equation, if we have progesterone over here and estrogen on the other side, we can play with this equation from either side, right? If we increase progesterone, that's going to create a progesterone dominance. If we increase estrogen, that'll create an estrogen dominance. But if we decrease progesterone, that also looks like an estrogen dominance. What if we increase estrogen because of increased aromatization of our testosterone to estrogen, because our testosterone is up due to insulin resistance / diabetes / blood sugar issues? Now we have a patient that looks like she's estrogen dominant, but a lack of progesterone is not the issue. Do you see what I'm doing here? So whereas mainstream medicine listened to her symptoms, gave her basically a Band-Aid for it, what happened was they let the underlying true cause and physiology of the whole picture, they let the underlying cause continue to burn and snowball out of control. And so yeah, she may have less hot flashes because we're covering it up by increasing progesterone. So basically helping the equation on one side, but we're letting the A1C continue to grow, continue to climb. We're letting the fasting blood sugar continue to climb, even though she's on 2 diabetic medications. A1C causes high levels of oxidative stress. It destroys neurons. It destroys the brain. It destroys tissues, period. Glycates tissue and destroys it. Well, what happens to diabetics? Neurons die. They develop peripheral neuropathy. The brain atrophies and dies. They develop Alzheimer's potentially. Alzheimer's has been called type 3 diabetes in the research, insulin resistance of the brain. So what is functional medicine? What are the benefits? How is it different? I believe this example with this patient has shown you that where mainstream medicine is symptom focused and Band-Aid care, basically give you a medication which buys you time but doesn't buy you health. And if it buys you time but you just continue to be treated the same way, you end up like the average American that's on 13 medications and would tell you that they haven't had any help and they've been struggling for a decade. Whereas functional medicine is going to look at you and say, you are an individual. I see the diagnosis, but I'm going to lay that aside right now and reconfirm it to myself to see if does what's under the hood match what the diagnosis is. If it does, great. How do we deal with that naturally, and how do we address the cause of that diagnosis, not put a Band-Aid over the symptoms of that diagnosis? What are the benefits? The benefits are this can be done naturally most times, much less expensively than many of the blockbuster drugs out there, and it's going to provide health, whereas medications buy you time but not health. Functional medicine is going to buy you health, and because you buy health, you're going to have more time. And not only more time on a respirator or on life support, but more time that equals quality of life and memories with family and friends. So if you have a hormonal problem or any problem, chronic disease, chronic issue that's been bothering you for years, and you've been on the mainstream medicine carousel without results, it's time to speak with a functional medicine practitioner like myself and get to the bottom of things so you can get your life back and return to a life at optimal. I'm Dr. John Bartemus, and my passion is to help you live your life's passion. Have a great day.